So today we are going to study about the different steps of PTBD, which is a procedure done to remove any biliary obstruction. So the first step in PTBD is to get an access of the peripheral bile duct through a Chiba needle. So the patient that I'm going to show to you, we have already done a puncture through a 18 gauge Chiba needle and a Termo soft guide wire was passed through it. So this was your Chiba needle 18 gauge and this was your Termo guide wire which was seen in the biliary system. After that what we did, we passed a 6 French catheter, that is your KMP catheter. But before the 6 French catheter we also dilated the tract using the 6 French or 8 French dilator. So you can see that we are trying to pass this dilator up to the site of puncture of the peripheral duct. So we had a little difficulty in passing this dilator, so we used an 8 French dilator in this case. So once this tract was dilated, we passed a KMP catheter, which is a 6 French catheter. So you can see that this is your KMP catheter and this KMP catheter was passed over the Termo guide wire. So this was passed till the end of the guide wire, right? So now you can see that we have removed the guide wire and you can only see the KMP. So the next step is to obtain a cholangiogram using this KMP catheter. So we passed 10 ml contrast which was diluted. You can see that we have passed a contrast through this KMP catheter and this biliary system, it is getting opacified. So there was gross IHBRD in this patient and you can see that there is a dilated common hepatic duct in this patient. So once we have an idea of the site of stricture, okay, so this is probably the site of stricture, we are going to try to pass through this site with the help of a guide wire as well as KMP catheter. Now the next step is to insert a guide wire through this KMP catheter. So you can see that this guide wire, we are passing it through the KMP catheter. And this is one of the difficult steps in PTBD if the dilatation is gross. So we did multiple attempts. You can see in this video also that we are trying to negotiate this guide wire through the site of stricture, but we are not very successful in the early attempts. So multiple attempts, we have to be very patient in this. So we manipulate the catheter, we manipulate the guide wire also, but still you can see that we are not successful. So if we are not successful, what we can do, we can just keep an external drain in such cases, right? So we were about to stop this case and we were planning to put an external catheter only, but you will see what is going to happen as I move ahead. So these are multiple attempts that we are trying to do to pass this guide wire through this stricture site. This is probably the site of CBD, right? So now you can see that in one of the attempts, this guide wire passes beyond the stricture site, and what we will do over this guide wire, we will push the KMP catheter as well. Okay, so in this image we can see that this guide wire is passed beyond the stricture site into the second part of duodenum and we are passing the KMP catheter over it. So once the KMP catheter is inside the duodenum, we are going to remove this guide wire, and over this KMP catheter, now you can only see the KMP catheter. Over this KMP catheter we are going to pass a stiff guide wire, right? So here I was just trying to confirm that this KMP catheter was inside the duodenum. So we can see that there is opacification of the third part of the duodenum. Now I'm trying to pass this extra stiff guide wire, and you can see that this extra stiff guide wire, it is also pulling the duodenum also, and it is straightening the duodenum. Now once this extra stiff guide wire is within the duodenum, we will remove the KMP catheter. We will pass an 8 French ring biliary catheter, right? So once this ring biliary catheter, it crosses the left paravertebral margin, we are going to remove this extra stiff guide wire, and you will see that this distal end of this catheter, it is going to coil upon itself, right? And at last we will again take a check cholangiogram to see the position of the holes, as well as to see the position of the, to see if this is patent or not, right? So this was in brief about the PTBD procedure. Thank you.